Start by standing up. Stand normally, letting your arms hang by your sides, and don't try to have perfect posture. Close your eyes. Take a few moments to notice how your body feels today. Bring your awareness to your lower back. Notice if there are any areas of pain or tightness. Just notice what you feel. Don't try to change anything. Notice if you feel like your pelvis is straight up and down, or if it is tilted forward so that you're sticking out your belly, or if it is tucked under so that you're contracting your abdominals. Now bring your hands around to touch your lower back. Find your spine and start following your vertebrae down toward your pelvis. Right in between your hip bones, you'll find your sacrum. Your sacrum is a fairly flat, triangular-shaped bone. It's a few inches wide, and it's actually made up of 5 fused vertebrae, your sacral vertebrae. Keep following your spine down below your sacrum until you get to the very bottom. That's your coccyx, which is also referred to as your tailbone. I'll be talking about your sacrum and your tailbone when we get down to the floor, so I just wanted to take a moment for you to find them. Now come down to the floor and lie down on your back, on your carpet or exercise mat. Bend your knees and let your knees and feet be a comfortable hip-width distance apart. Close your eyes. Notice how your lower back feels in this position. Start bringing your attention to your breath. Most of the time we take fairly shallow breaths up into our chest, but right now I'd like you to start taking slow, deep breaths down into your belly. If you want to, you can rest your palms on your lower belly. Just bringing that sensation of touch to an area can help to increase awareness. Imagine that your belly is a big balloon, and you want to inhale and fill up that balloon as much as possible. Then just let the air slowly leak out as you exhale. In order to take a really full inhale and let your belly expand, you'll have to relax and let go of your abdominal muscles. We're always taught to hold our belly muscles tight so that we can stand up straight and not have our stomach stick out. So letting go of these muscles to take a really full breath can be difficult. We usually don't think about the muscles involved in breathing because they're controlled automatically by our brain. But the muscles involved in breathing can be controlled by our conscious mind as well. That's what you're doing right now. The biggest muscle involved in breathing is the diaphragm. The diaphragm is a large sheet of muscle that separates your thoracic cavity, or the upper half of your trunk, which contains your heart, lungs, and ribs, from your abdominal cavity, the lower half of your trunk, which contains your organs and intestines. As you inhale, your diaphragm contracts and presses down toward your belly, drawing air into your lungs and forcing your belly to expand out to the front. As you exhale, your diaphragm releases, pressing back up and forcing the air out of your lungs. We don't usually think of breathing as being a movement, but it is. It's a contraction and then release of muscles. So as you inhale, imagine your diaphragm slowly contracting and pressing down toward your belly. Then see how slowly you can release your diaphragm as you slowly exhale. Take a few more breaths like this, inhaling fully, and then exhaling and releasing as slowly as you can. Now remember how you found your sacrum when you were standing up. Go ahead and very gently press your sacrum down into the floor, and then slowly release. Just do that 1 or 2 more times so you have a good sense of where your sacrum is. As you press your sacrum down into the floor, you might feel the back of your head pressing into the floor too. We're going to learn a movement called the arch and flatten. We'll start by focusing on just the arching part, then we'll do the flattening, and then we'll put it together. When you're ready, Inhale into your belly and press your sacrum down into the floor. Keep pressing gently and slowly start rolling that pressure down toward your tailbone. This will make you stick out your belly even more, and you'll feel your lower back arching off the floor. Now slowly start exhaling and releasing that pressure, letting your pelvis slowly roll back to neutral, just back to where you started. Take a moment to rest before you do this movement again. When you're ready, start with an inhale, letting your belly fill up, and gently press your sacrum down into the floor, and then roll forward so that you're pressing your tailbone down into the floor. Then, as you exhale, slowly start letting go and releasing, allowing your pelvis to roll back to neutral, and letting your lower back float back down toward the floor. You don't have to use any muscle or force to come back to neutral. Just let yourself come back to neutral by releasing. As you roll your pelvis forward and arch your lower back, the muscles in your lower back are gently contracting and getting shorter. You might feel your hip flexors on the front of your hips contracting as well. This time, count to 12 as you slowly release that arch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That's how slowly you should be releasing in order to get maximum benefit from this movement. So we just explored the arching part of the arch and flatten, and now we'll explore the flattening part. While you're resting here in neutral, go ahead and inhale down into your belly, but don't arch. Now, as you slowly exhale, gently press your lower back down into the floor. See if you can get the feeling of hollowing out your belly. When you're ready, very slowly release back to neutral. When you're ready, you can inhale again, filling up your belly. Then as you exhale, go ahead and gently flatten your lower back down into the floor. Hollow out your belly, and notice how your belly muscles are gently contracting to help you press your back into the floor. Feel that contraction, and now see how slowly and how gently you can release it to come back to neutral. Go ahead and repeat this flattening movement one more time, starting in neutral and inhaling, then flattening your back down into the floor and hollowing out your belly, then very slowly releasing back to neutral. Now let's go back and forth from the arch to the flatten. First, inhale and fill up your belly as you press your sacrum down into the floor and roll down to your tailbone, letting your back arch off the floor. Then very slowly exhale and release as slowly as you can to come back to neutral. It's very important to come to neutral before you flatten. While you're in neutral, take a big inhale down into your belly. Then exhale and flatten your back down into the floor, hollowing out your belly. When you're ready, release as slowly as you can to come back to neutral. So far we've been focusing just on the lower back, but now start to become aware of your whole spine from top to bottom. There are little muscles that connect each vertebra to the one above and below it. Your whole spine is connected by muscles from top to bottom, so unless you're holding some of these muscles tight, when one part of your spine moves, the rest of your spine should naturally respond in some way. Let's explore that right now. See how relaxed you can be through your entire spine, up through your upper back, your neck, and your head. As you arch and flatten, see if you can allow your head to start gently nodding. So as you arch your lower back, your chin will tuck down toward your chest, as if you want to look at your full belly as you inhale. Then as you flatten your back down into the floor, your chin will tip up toward the ceiling as if you want to look behind you. Don't force this movement. Just see if you can relax and allow this gentle nodding of your head to become a natural, easy part of the movement. Now finish up the movement that you're on, and slowly come back to neutral and rest. Take a moment to notice how you're feeling after doing the arch and flatten. Check in with your hips, your lower back, your whole spine all the way up to your head, and just notice any changes or new sensations that you're feeling. When you're ready, gently roll onto one side and press your hand into the floor to help you get up to sitting. When you're ready, slowly come to standing. Stand normally, letting your arms hang by your sides, and don't try to have perfect posture. Close your eyes. Take a few moments to notice how your lower back and pelvis are feeling.